Welcome to the Live to 110 podcast, the video podcast. I am your host, Wendy Myers, and you can find me on live110.com. And you can find the video podcast on my YouTube channel, which is Wendy Live to 110. And today we have my very good friend, Rick Malter, Dr. Rick Malter, on the podcast today. And we're going to be talking about the history and the future of hair mineral analysis. I have become obsessed with hair mineral analysis. I love using this tool with my clients because I found it's really one of the most effective things. It's such a useful tool that we need to look at body chemistry. You have to look at someone's body chemistry to be able to heal someone's health conditions and to, improve their health and heal their thyroid and adrenals and heal so many health conditions that baffle medicine. So basically, we're going to be talking about who started hair mineral analysis, who the major players are today, and what are some of the exciting developments in the field, and why it's also such an effective tool for naturally healing health conditions. But first, we have to do the disclaimer. Please keep in mind that this program is not intended to diagnose or treat any disease or health condition and is not a substitute for professional medical advice. The Live to 110 podcast is solely informational in nature. Please consult your healthcare practitioner before engaging in any treatment that we suggest on the show. And I'm really excited. I've got a brand new website, live110.com has gotten a facelift, so definitely go check that out. And I've also launched my new Mineral Power program where you can use a hair mineral analysis to gauge what's going on inside you, and I give you a whole program, diet, lifestyle, detox, and supplements to heal what's going on in your body. Our guest today is Dr. Rick Malter. In 1971, he earned a PhD in education and school psychology from the University of Illinois. He is a licensed nutrition counselor as well as a licensed clinical psychologist. For the past 30 years, Dr. Malter has had a strong interest in nutrition and hair mineral analysis. Before he retired from his clinical psychology practice, nutrition and hair mineral analysis were very valuable components and services that he offered to his clients, which included children, adolescents, and adults. And in 2002, he wrote The Strands of Health, a guide to understanding hair mineral analysis. And the book basically introduces the basic concepts related to understanding hair mineral analysis, also called htMA. Hair tissue mineral analysis. It's a great book. I'm almost finished with it. And I think it's a wonderful resource for anyone that wants to learn why they should be doing a hair mineral analysis. And Dr. Malter continues to offer many different kinds of seminars on his site, malterinstitute.org, and does hair analysis consultations. So Dr. Malter, thank you for coming on the show.
Thank you for inviting me. I just need to clarify one thing.
Yes.
I retired from my practice in May of 2001 and left Chicago to move to my home in Cottonwood, Arizona. And after I was down here a couple of years, I let my licenses lapse.
Okay.
I was going to be in full-blown retirement.
Oh, nice.
With the internet and networking, I got active in doing consultations and setting up my seminars. Mm-hmm. So I'm no longer currently licensed. Okay. I was licensed for many years in Illinois, and I just let the licenses lapse. Okay, so great. It's just important to clarify that point.
Yeah, accidentally on purpose, so you can stay retired. Well, so why don't you tell the listeners a little bit about yourself and why you love hair mineral analysis so much?
Well, I love hair mineral analysis because without a doubt, I think it literally saved my life and restored my health 34 years ago in 1980. I was in a total state of burnout. And for your listeners who know something about blood sugar testing, my fasting blood sugar at the time was 45, which is just above being in a coma. It's so low. And my doctors were baffled why I was in such a burned out state with such a severe reactive hypoglycemia. Fortunately, I was working with a couple gentlemen who had a wonderful outpatient clinic for kids with learning disabilities, attention deficit disorders, developmental delays, and other developmental problems. And they asked me to be their psychologist doing psychological and intelligence testing, which I did. And I was intrigued with watching them do their various optometric evaluations for vision, sensory motor testing, allergy testing, and educational testing. And they also did hair analysis. And I was just intrigued with all the things they were reporting to parents from the hair analysis.
That's very cutting edge that they were doing that.
They were really cutting edge. And fortunately, I was hooked up with them because the educator, Dr. Ken Candelaria, a PhD educator, brilliant man, told me one day when we were out for coffee that I better get a hair analysis because I didn't look good or healthy. Something was drastically wrong with me. So he got a hair analysis. And when he got the results, he told me that I was this close to a heart attack.
Wow.
That got my attention. How did he know that? Well, my hair mineral analysis magnesium level was 0.9 milligrams percent, or 9 parts per million. The ideal magnesium is 6 milligrams percent. So it was way down 90% below ideal.
Wow.
So that got my attention and launched me on my magnesium obsession.
Yeah, I see you're wearing a magnesium t-shirt.
My magnesium man t-shirt. So, so I got on magnesium and slowly but surely rebuilt my blood sugar levels to normal, rebuilt my energy, cleared my foggy mind, and got me very intrigued with it. I began reading Dr. Paul Eck's 1981 interview with the editors of HealthView newsletter. That's a classic. You can get that from the Analytical Research Lab in Phoenix for a few dollars. It's a great read and introduction to hair analysis. And then I started flying down from Chicago to Phoenix to attend once or twice a year seminars with Dr. Eck and his colleague, Dr. David Watts. And I was just blown away by the information they had and the information they could derive from this simple test. Now, a lot of people assume that if you squeeze the hair and not pull it, but just squeeze it, you don't feel any pain. So they say, well, hair is dead. How can you get live information out of it? Well, the minerals do not deposit randomly in the hair analysis. The minerals are driven by various lifestyle factors: stress, what we eat, what we drink, supplements, drugs and medications, relationships. The hair analysis, besides being a physiological test, is a psychological test because the minerals are closely related to the stress response. And stress has a physiological and a psychological component, the fight or flight part. Fight is anger and rage, and flight is anxiety and panic. So as a psychologist, this was a great find for me to discover hair analysis. Much better than the Rorschach ink blot test.
Yeah. I've studied psychology a long time. I've been obsessed with psychology and reading books and taking classes and clinical psychology, etc. And I was really blown away when I learned how so many metal toxicities and mineral deficiencies drive our behavior and our personality. And it made me think, like everything else I had learned, I thought was just a waste of time.
Yep.
Because you have to heal copper toxicity and other issues in the hair test before you can have mental health.
Right. And when we look at a diagnostic manual like the psychiatrists publish every 10 or 15 years, their DSM manual, they just came out with the 5th edition. And they keep increasing the numbers of mental illnesses that they fabricate. And you could lump virtually all of their so-called mental illnesses under the rubric of stress and variations of it. and along with stress, the impact of toxic metals. So you could shrink this big, thick diagnostic manual down to a very, very thin little booklet.
Yeah.
If you focus on what a hair analysis reveals about a person's stress and toxic metals.
Yeah. So how long have you been doing htMAs?
Well, I started in 1980 with my first hair analysis that picked up my magnesium deficiency
Yeah.
and pulled me back from the brink of a heart attack and diabetes. So that really got my attention. And then I began attending the seminars. And one of the things that I realized in attending the seminars, and if you ever listen to some of the recordings of the seminars, Dr. Eck was a great storyteller. He had a deep, booming voice. And so he would start off talking about hair analysis and the fact that it could identify a person's oxidation type. Are they a fast oxidizer or a slow? Well, before long, he was already talking about copper toxicity and going off on tangents, talking about copper toxicity and how many women he knew who were copper toxic. Well, those were very interesting anecdotes, but it didn't make for easy learning of the basic concepts because he'd go off on all these tangents. It was very entertaining, but it was a real struggle to follow along and to understand how did he arrive at fast oxidizer profiles and slow oxidizer profiles.
Which is someone's metabolic rate, basically, in a nutshell.
Yeah. Now, part of my psychology training was in learning and curriculum organization. Because part of my training was in school psychology and educational psychology. And after a couple of seminars, these were 2-day seminars, Saturdays and Sundays, I said to myself, this is wonderful information, but it could be boiled down to just a few hours if it's organized properly. And if you sequence the introduction of the concepts and illustrating the graphs in proper order, then you could condense it and you could teach it very, very efficiently, and that would facilitate people learning it. Now, one of the things that became very clear to me, well, for one thing, Dr. Henry Schroeder, an MD many years ago, made the statement that minerals are the spark plugs of life. That's the foundation for hair analysis. It gives us a way to assess our mineral status and how the minerals are interrelated all the way down to the cell and tissue level. So that's part of the context from which I view a hair analysis. These are the spark plugs of life.
And they give us energy. With so many of my clients, they start a program doing htMA and taking the minerals to balance the imbalances on the hair test, and most of them instantaneously report more energy.
Yep, because it's geared to the mineral imbalances in which nutrients are needed to start the rebalancing, to pick up the low ones and to reduce the toxic or out of balance ones. And the minerals also are interrelated in what I would refer to as a very dynamic, constantly changing system that's closely connected to our nervous system, the sympathetic part of it, the stress part, and the parasympathetic nervous system. And the endocrine glands, primarily the adrenals and thyroid. But when the thyroid shows low in the hair analysis, that would be a high calcium to a low potassium, then the parathyroid gland is overactive, and that's forcing calcium into the wrong places, like into soft tissues, joints, and arteries. and around the organs.
That's exactly what I had. When I first did my first test, I had high calcium, about 120, and
Yep.
it just painful muscles and achy joints, and I'm sure some calcifications in my arteries, and it was
Yep.
very unpleasant, and those have all gone.
Yep.
It's all been broken up.
Now, if you had known Dr. Eck, he would have looked at your blondish hair and said, well, obviously you're going to be copper toxic and have this high calcium.
Mm-hmm.
And so you could have become one of his anecdotes
Yeah.
30 years
Yeah.
ago.
I was copper toxic when I first started.
Of course you were.
Yeah.
It is such an epidemic. And what Eck and Watts were able to do is they traced it back to the pioneering research of Dr. Carl Pfeiffer, an MD and a PhD in Princeton, New Jersey. And Pfeiffer had written a book, Mental and Elemental Nutrients. And one of his chapters was on copper toxicity. And Pfeiffer founded the Brain Biocenter in Princeton. And so one of his focal points in his clinical work and research was on the connection between estrogen and copper. So ever since the birth control pill and hormone replacement were introduced, that started a cascade of changes in the mineral patterns of teenage girls and young women, and turned them into copper toxic, very low energy, very burned out young people.
Yeah. Yeah, I was on the birth control pill for 20 years.
Yeah,
And yeah, it did a number on me.
it did a number on you and how many millions of others.
Yeah.
And it's interesting listening to the Supreme Court cases about contraception now with the Hobby Lobby case. And they totally miss the profound impact that the birth control pill has had on the health of teenage girls and women.
Yeah.
And what are we going to do to counteract that adverse trend that's literally destroyed the health of countless numbers of women?
And so is there any other way to balance copper besides doing a mineral balancing program using a hair mineral analysis?
Well, there's other ways. You can use IV penicillamine, but that may take out too much too fast. When it comes to detoxing, timing and pacing is an important concept. And there may be certain acute cases of toxicity where IV chelation may be warranted. But for most people, it's best to use nutrition and supplementation to begin to provide the body with its nutritional support and to trust the wisdom of the body to know when is the right time to start releasing excess copper or other toxic metals.
Yeah, and it just needs minerals to do that.
Right. And once you start detoxing copper, for some women, it can be an absolutely debilitating temporary process. And I advise young women or teenagers in school, don't try to detox copper if you have an important paper to write or if you have important exams coming up. Because if you're in the middle of copper detox, it's like you're in the middle of PMS and the flu.
Yeah.
And your brain is not going to be working optimally. You will be at a distinct disadvantage until you pass through that temporary detox phase.
Yeah, it's a necessary evil.
Yeah.
Absolutely. So you're called the Magnesium Man, along with your buddy Marley Robbins.
Yeah,
So why are you called the Magnesium Man?
Okay. Well, as I related, I started off with hair analysis 34 years ago because it showed I had an acute, life-threatening magnesium deficiency. So I've been reading and talking about magnesium and magnesium deficiency for years. And here in Cottonwood and in Sedona, we've had networking groups that my wife and I have participated in. And virtually every time I would get up to say a few words, it would be about hair analysis, magnesium deficiency, and heart attacks. So one time at a luncheon meeting, I get up to speak, and one of the ladies says, "Oh, here's Magnesium Man." So she dubbed me Magnesium Man,
And it's stuck.
and it stuck. And there's a wonderful T-shirt place in our little town here. So I went down there and told them I'm interested in having them design a Magnesium Man T-shirt for me. So they went ahead and designed this T-shirt, and I got a couple for Morley, a T-shirt like this. But I also got him a sweatshirt because he was still up in the Chicago area
Yeah.
at the time. So I got him a Magnesium Man sweatshirt for the winter up there. So that's how I became Magnesium Man, because I feel it's such an important issue. And I would say that with hair analysis, what we have learned is how pervasive copper toxicity is and how pervasive magnesium deficiency is. I would estimate that copper toxicity and magnesium deficiency probably account for at least 85 to 90% of health problems.
Yeah.
And that includes mental health as well as physical health.
Yeah.
And when medical doctors and psychiatrists try to tease out a diagnosis based on a few symptoms without knowing the underlying biochemistry, turns out they're guessing. And in some ways, I feel badly for those kind of practitioners because they don't have access to such good data as are available through hair analysis.
Yeah, I really admire that you use that in your practice, because you truly helped your clients rather than just doing the talk therapy and maybe some diagnostic testing. I think it's doing a hair tissue mineral analysis is one of the truly only ways to truly get to the underlying causes of mental illness.
Right. When I was early into my use with hair analysis back in 1983, a young woman brought her 9-year-old ADHD kid in to see me. And he had gone the route of Ritalin and all the other medications, and they were about to throw him out of school. And he was a classic hyperactive kid. And at that time, I had a behavior rating scale that had 36 points on it. And when the mother filled it out, he was still rated 36 out of 36. Very, very hyper. And so we got a hair analysis on him, and he was a fast oxidizer, fast metabolic type. Low calcium magnesium, high sodium, but potassium was even higher. And his copper was 0.8. The ideal copper is 2.5. Real low copper, which is very typical of a fast oxidizer. We put him on a supplement program, and 3 months later, we retested. In 3 months, his copper went from 0.8 to 24.
Wow.
That's what we call a copper dump or a copper detox. And he went temporarily into a slow as his copper came out. And I had the mother re-rate him. And the rating dropped down from 36 out of 36 to somewhere down around 25 out of 36, indicating he was calming down.
Yeah.
So there was a 30-fold increase in the copper level in 3 months.
Wow.
And he made a very interesting observation. As I was talking to him about what the changes were, he said, now I understand when people say, if you do this, then this will be the consequence. When he was so copper toxic and hyperactive, he could not comprehend and apply if-then consequences. His system was too revved up and out of control.
Yeah, a lot of my clients report they have mind racing. That I've got many friends as well that they're all copper toxic, and people report their mind is racing, they can't calm down, and they're doing all kinds of things, compulsive exercising to try to calm down.
Yeah. But that's also the kind of drivenness that you get with copper toxicity. It revs the mind up so much that the person feels driven in a very, very addictive and compulsive manner until they crash. So one of the slides in my copper toxicity class shows somebody totally exhausted with their head on the desk. And right beside that is a little figure running and racing. That's a graphic summary of the effects of copper toxicity. Physical exhaustion, because the cells can't produce adequate energy, but the mind is racing.
Yeah.
And thoughts race. And there's sleep disturbances. And a lot of ADD kinds of distractibility can be traced to copper toxicity.
Yeah. Well, I had a few questions about, it's very frustrating for me why hair mineral analysis has such a poor reputation among doctors and other healthcare practitioners. And even on quackwatch.com, I've had many clients go on, do a search and find Quackwatch that hair tissue mineral analysis is invalid and it's quackery and la 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 la. So why is that?
Okay. Well, from your psychology studies about the concept of projection.
Yeah.
Okay. I believe Dr. Stephen Barrett of Quackwatch is projecting about quackery. Hair analysis was really picking up a lot of steam and interest from 1980 to 85. The seminars were drawing a couple hundred people on weekends. So there was a lot of interest in it. And then in August of 1985, JAMA, the Journal of the American Medical Association, published Dr. Barrett's article about commercial hair analysis. And they had commercial in quotes, as if big pharma is not commercial.
Yeah.
Only hair analysis labs are commercial. So some clients of mine had seen a newspaper article describing the results of Barrett's study, which really slammed hair analysis. So I got concerned and I went over to the local hospital medical library and pulled out the journal to read the article. Well, first of all, he based his study on hair samples from two 17-year-old girls. And he used shoulder-length hair. And you know that the hair analysis labs say cut the first inch to inch and a half of hair from the scalp, not shoulder-length hair, to get a valid current sample. So it was obvious he used really extended amounts of hair growth. And then he cut them into 1-inch segments. So you figure that there's at least 5 or 6 inches of growth from the back of your head down to your shoulders. So he cut all these hair lengths into 5 or 6 segments and then mixed them all together. And don't forget, this was based on samples from two 17-year-old girls.
Yeah.
And
it doesn't sound like a study to me. No. You have to have a sample study of 20 people at least to have a valid the results being generalized to the population.
That's right. So, but this was what he did is he cut enough hair with those shoulder length samples to send off to 13 different labs. And as you know, some of the labs overwash the samples as part of their handling and processing of the hair samples, and others don't wash them. That makes a huge difference in the measurement of the sodium and potassium quantities in the hair sample. And in Barrett's study, he didn't report specific numbers that were generated by the lab's computerized equipment. He summarized his results in terms of whether the mineral was showing high normal, or low. Now that's a much cruder set of measurements than if you're reporting very specific numbers. So that right away alters the accuracy of the results.
Yeah.
Because it depends on how each lab generated its norms to determine high, normal, and low. But it was very interesting. When you look even at that crude data that he reported, both girls had high calcium, high magnesium, and what do you think their copper levels were?
High, yeah.
Yeah. So without even reading the article, you know from that the copper was high. If anything, he validated hair analysis, showing that these two 17-year-old girls had high copper and were slow oxidizer types with the high calcium and magnesium.
And that was so long ago. Why does that still persist? There's so many doctors that still
Because-
don't consider it valid.
Because it was published in JAMA, and as soon as it was published, it was accompanied by a massive press release and media campaign. And you know that once the media gets hold of an issue, it gets imprinted in the public's mind and also in the mind of professionals.
Yeah.
And it was like a warning sign to medical doctors, psychiatrists, psychologists, and other practitioners. Don't you dare dabble in or mess with hair analysis. It's invalid. It's not scientific.
Yeah, because that's even what I ran into before I had my hair test, and my first one, and I was considering getting one, and you know, it's not that expensive, but when I considered doing one, I was asking around, and the general consensus was they're not very accurate, but it doesn't hurt, you know, might as well try it. But I mean, accurate for what?
Yeah.
It depends on what your goals are. The minerals in the hair are going to be different than the minerals in the blood.
Yep. Well, medical doctors, when they do different kinds of research projects, seem to get confused about the accuracy of a test versus its clinical validity. Accuracy has to do with whether you get the same results if you divide a sample into two and you run both samples. The accuracy of hair analysis is phenomenally good, and you could get data on hair analysis accuracy from any of the licensed labs. They have to maintain high levels of accuracy and data to support that. So there's no question, as a technical laboratory chemical analysis, it's highly accurate. What they're confusing is the issue of whether it's valid or not. So for example, we know that copper in excess stores primarily in the brain and in the liver. Well, if you want to validate a person's copper level with the tissue analysis, besides hair, what tissue are you going to take? Are you going to take a liver biopsy? Are you going to take a brain cell biopsy? Or are you going to take a little sample of tissue from the hand or the arm? And so that's one aspect of it. Does the hair analysis copper level, as an example, correlate with body loads of copper? Well, if you check liver and brain tissue, you'll get very high correlations. But another way to validate it is to list the copper toxic symptoms. And these will be both psychological and physiological. You'll have hypothyroid as major symptoms related to copper toxicity. And invariably, women who are copper toxic have very slow metabolism. They are showing signs of severe hypothyroid, and the low energy of the thyroid then becomes a drag on the adrenal glands, and sooner or later you find that the person not only has a slow thyroid, but their adrenals have been dragged down into an adrenal burnout.
Yeah.
So their energy production is really drained like a battery.
Yeah, that's what I see with every single one of my clients. They have low thyroid function, and many clients have very, very low adrenal function,
Yeah.
like stage
Yeah.
3 adrenals. By the time they've come around to find me and hair tissue mineral analysis, they've been to every doctor, then
Yeah.
all this stuff. Nobody has helped them because no one is addressing nutritional status and detox for the most
That's
part.
right. And what you'll also find is that many of these women also have a high calcium, low magnesium ratio. So even though the magnesium is showing high in the hair analysis, it's much lower than the calcium.
Yeah.
So you have a calcium magnesium imbalance. Too much calcium, not enough magnesium.
Mm-hmm.
That affects blood sugar regulation and insulin. It leads to very tight, tense, spastic muscles. And it means that they also will experience all kinds of magnesium deficiency symptoms. So then the question becomes, how do you give them magnesium, which they need, without putting the adrenals completely to sleep? Because if you give magnesium, you slow down the adrenals. So you have to strike a balance between some magnesium supplementation and enough adrenal support to maintain a buildup of energy. And that can fluctuate literally from day to day. So what I work on is training my clients to be aware of when they think they need more magnesium and when they need less. When do they need more adrenal support and when do they need less? So you mentioned before how many people have been going all over trying to get help. Well, a lot of them get on these Facebook chat groups for adrenal burnout and adrenal fatigue. And then they try all different ways to give themselves nutritional support for the adrenals, whether it's herbal or vitamins and minerals, whatever it is. That may give them a temporary boost in adrenal function, which then can start to raise their low sodium level. But as the sodium starts coming up, magnesium goes down. So if they're trying to revive their adrenals without knowing their magnesium status, very quickly they'll feel awful because they have gotten some pickup of adrenal activity at the expense of losing magnesium.
That's what I love about mineral balancing and using htMAs, because one mineral affects another one and you have to supplement in just the right way to bring everything up eventually.
Yeah.
So interesting.
And to be aware of those dynamic interrelationships. And that's what, in my view, puts hair analysis head and shoulders above all kinds of other approaches to nutrition and healthcare.
Yeah.
Because minerals, as Dr. Schroeder mentioned, are the spark plugs of life, and hair analysis allows us to see a person's mineral status.
Yeah. Yeah, because people can do homeopathy, they can do acupuncture, they can do all kinds of stuff. It's not going to help if they have low mineral status. It's not going to work.
Yeah. So I view hair analysis and minerals as the spark plug of life as being at the center of the target. You know how the Target stores have their big target?
Yeah.
Well, minerals and hair analysis, in my view, are at the center of the target. There's lots of other good interventions and treatments and practices, but they're much more on the periphery of the target.
Yeah.
And if you don't hit the bullseye to start with, you could literally spin your wheels going round and round the periphery of the target. Some people will get some benefit, no doubt about that. But for most people, hitting the bullseye by appreciating the importance and value of our nutrient minerals, and that hair analysis allows us to really get a sense of what a person's mineral patterns and status is.
Yeah, and I don't mean to disparage acupuncture or other things. They're very, very good treatment modalities, but it's just that I think other things are more important, like raising someone's mineral status.
Yeah. Now, one of the metaphors I use is there's such a vast body of knowledge and complex information out there, especially as it relates to the mind-body interrelationships. I mean, the amount of information from the most minute biochemistry all the way up to heart function, brain, kidney function, and so on. It's a vast body of information.
So who started hair mineral analysis? Like, who invented this?
I really don't know where it started as a chemical lab analysis. I think it started in horticulture, in animal husbandry or zoology, and they found that you could cut hair from the coat of an animal and measure the mineral content. So I think that's how the basic laboratory technique got started. But it wasn't until about 1975 when Dr. Eck and Watts got together in Phoenix and began looking at the case data of Dr. Watts' chiropractic patients and looking at the blood work and the urine work and what the presenting health problems were, that they began to make the connections. And so they were able to develop this phenomenal conceptual and organizational framework to really understand the significance of mineral patterns, relating it to the autonomic nervous system, sympathetic and parasympathetic, to the endocrines, the adrenals and thyroid and parathyroid, and the energy pathways, the Krebs and glycolysis cycles, how energy is produced in these delicate pathways. And if one component is missing, like magnesium, everything falls apart. And one of the things that Morley is really focused on is the connection between magnesium and ATP, adenosine triphosphate, which are necessary in combination to produce power and energy in the mitochondria within the cells, and especially within the heart cells. And if you're acutely magnesium deficient, sooner or later you're going to hit a point where the heart no longer has adequate energy to keep its rhythm beating efficiently and to produce enough power. It's not cholesterol, and it's not going to be corrected by statin drugs.
Yeah.
And so the magnesium factor related to ATP is vital for understanding cellular energy and especially heart energy.
Yeah. So Dr. Eck and Dr. Watts, how long did they collaborate together?
They collaborated for about 9 years, from 75 to about 84. And Watts, being a chiropractor, started writing articles about their hair analysis research and publishing them in some of the chiropractic literature, some of the nutrition literature, the Journal of Orthomolecular Medicine that was started by the late Dr. Abram Hoffer in Canada. And so he was getting a lot of recognition. When you publish, that really expands your audience.
Yeah.
And Eck really didn't write or publish very much. Even the HealthView newsletter article is really an interview with him, where he is orally explaining things. So his strength was orally explaining things, not in writing. And it reached a point where Watts also felt that it was necessary to modify the formulas of the supplements based on what hair analysis research was showing, and especially in regard to the dumping off of excess copper or copper detox. And if you ever listen to any of the audio tapes of the seminars from the 1980s, copper was Dr. X baby, so to speak.
Yeah.
And he kept emphasizing, when you dump copper, you go into a sodium-potassium inversion. That means your sodium is low, but potassium jumps up. And then they would supplement accordingly.
Yeah.
And Watts observed this wasn't working. Something was wrong with the way they were interpreting that phenomenon. And he realized from their hair analysis research, copper lowers potassium. So how could it be, if a person detoxes a lot of copper, that potassium would go up? And he realized, well, the cell is losing potassium. It's building up in the blood temporarily, going to the kidneys and being eliminated in the urine. But the hair also is a pathway of excretion. So temporarily, the potassium goes up in the hair with the copper detox, when it's really reflecting a further loss of potassium. So if you supplement with potassium, the person gets better.
Yeah.
And Eck wouldn't hear of it. And he sent Dr. Watts on his way.
Yeah.
So Watts left the ARL lab in Phoenix, and when they had an established Trace Elements, his own lab, and he's developed that over the last 30 years with great success. And once he established the TEI lab, he applied those interpretation modifications to his hair analysis interpretation. And then Dr. Wilson came along about the time that Watts left, and he only got X interpretation.
Mm-hmm.
And so, as far as I know, he never picked up on the potassium loss phenomena with detoxing copper. And that's a major difference between our approach with TEI and the Analytic Research Labs approach.
Okay. And you're referring to Dr. Lawrence Wilson of
Dr. Lawrence Wilson, right.
drlwilson.com. He's very prolific. He's written almost 1,000 articles on...
Yeah, Dr. Lawrence Wilson is a brilliant man. I understand he got his bachelor's degree from MIT. So you know he was quite a brilliant man. And you can see how prolific he is in the amount he's written.
Yeah.
My book is a thin little book.
Yeah.
Compared to his. But I think I hit the bullseye more directly with mine.
Yeah, your book, it's very succinct, and it's digestible, and I think it's a very good thing for a layperson to read and kind of get an idea of hair mineral analysis and how it can help them.
Yeah, my book really was a transcription of my early seminars when I had overhead transparencies that showed the mineral pattern for a fast oxidizer and for a slow, and so I put it into book form after I retired.
Yeah.
10 years.
So what are some of the exciting developments in hair mineral analysis? Like kind of what's going on, and what are some changes that have happened, and some of the other, big proponents of it?
Well, unfortunately, the labs have never gotten together because they are commercial labs. They are businesses with huge overheads.
Yeah.
And the market is somewhat confined. So they are basically competitors. And as far as I know, they never have gotten together as professionals to look at their data and to look at different studies and clinical cases. I think one of the best ways to learn to appreciate hair analysis is to look at individual studies that are usually dismissed by medical doctors as only anecdotal. Well, we can learn a great deal from individual cases.
Well, it's sad that Dr. Eck, he passed away about 15 years ago.
Yeah.
And Dr. Watts, he's still running TEI. So essentially at ARL, there really haven't been much in the way of not improving their labs, but just improving their research and updating and, looking for the newest information. But at least Dr. Watts, he still runs TEI today.
Yeah. And ARL still produces very good, accurate results, even after the passing of Dr. Eck. But I never got a sense there was anybody there to step in and continue to do some of the basic research.
Yeah.
And to consider some of the challenges with the formulas and the supplements that they recommend.
Yeah.
And the hair analysis, in my experience, is a highly individualized lab tool. And I found I really have to tailor my explanations to the individual. Some people want a very detailed, complex explanation of what does this mean, what does that mean. Others say, just tell me what I should eat and tell me what supplements to take.
Yeah.
So you have a wide variety. And I have some reservations about the hair analysis labs having extensive printouts along with reporting the basic mineral data and toxic metals. I think the printouts wind up being an introduction to hair analysis concepts and principles. And I think that's a function that should be left as an educational function, separate from the laboratory workup.
Yeah, because I know at ARL they give you this 17-page report, but it's a computer-generated report, so it can only be, it's limited. It's very general.
It's way too general, and it doesn't zero in on what the concerns are of the individual client patient.
Yeah.
And so I think what I recommend to people who take my training course is when they're first starting out, get the full computerized printout so you can see what TEI is saying in its full printout. And then also you get some idea what are Dr. Watts' dietary recommendations and which foods is he recommending to omit and leave out depending on your hair analysis pattern. That's valuable information.
Yeah.
But once you have a few cases like that, and once you get a good handle on interpreting what you're seeing in the hair analysis, then I think it's best to just do the 2 pages of the numerical report and graph.
Yeah.
And then tailor the recommendations to what you're seeing are the primary imbalances and toxicities. And what you sense is going to be acceptable to the individual client in terms of numbers of supplements. Like I just reviewed a couple hair analyses today, a mother and child, and I only recommended Simpac for the child and a Parapac for the mother, and Midplex B for the mother. Even though I could have come up with a rationale for several more supplements. What I sensed in my discussion with the mother was let's just start off with a small amount.
Yeah. Yeah, and that's where a lot of people are. Some people, they just are not going to take a big, 10 pills a day or with every meal. And so you have to start people where they're at. And that's okay.
Yeah. Now, one of the best supplements I found over the years is Endomet's Spartan MK,
Hmm.
magnesium, potassium, aspartate.
Yeah.
30 years ago, Dr. Eck was raving about Spartan MK because it's a combination that gets magnesium and potassium into the cells and starts to give an energy boost in the mitochondria. And so a person who's got chronic fatigue, just taking a few Spartan MKs a day can give them some encouragement because they feel a boost in energy.
Yeah.
And I noticed that Dr. Wilson rarely, if ever, recommends Spartan MK.
No, he doesn't. He doesn't.
No. And one of the reasons why I recommend Spartan MK, especially for copper toxic, very burned out, low energy women, is it provides an energy boost without throwing them into a quick copper detox.
Yeah, yeah.
And as you know, a copper detox is not going to be very comfortable.
Yeah, so my clients are pretty miserable. It's a
So
necessary evil, though, so that they can feel better afterwards.
Yeah. What I would do with my transparencies 30 years ago is draw a roller coaster
Yeah.
up and down. And I would explain to them, you have a high copper. You have to choose. Are you going to ride the copper roller coaster and get rid of that excess copper and restore your energy, or you're going to keep plodding along in burnout?
Yeah.
So I would talk about the copper roller coaster.
Well, Dr. Malter, thank you so much for coming on the show.
It's been a pleasure.
Yeah, and so why don't you tell the listeners a little bit more about you and where they can find you?
Okay, you can find me in Cottonwood, Arizona at the Malter Institute, and my webpage is malterinstitute.org. And I've got some of my articles on there and some information about hair analysis. And my wife and I have our books described there. Shrinking the Judge, Freeing the Inner Child is about the inner judge or inner terrorist. And of course, the Strands of Health book. Those you can order directly from me. My phone number is 928-649-9343. And the webpage is www.malterinstitute.org.
Yeah, and listeners, I highly recommend his book, The Strands of Health. It's really, really good, and I've really, really enjoyed it. Almost done with it. I'm probably going to finish reading it this week.
Okay.
Yeah, I've really, really enjoyed it. It's been
Okay, and I just want to mention my email address also. It's rickmind, RickMind, at cable1, CABLEONE.net.
Well, thank you so much, Rick.
It's been a pleasure, Wendy.
Thank you. And if you can consult with him personally, if you want to get your hair tissue mineral analysis and see what Dr. Malter has to say about your health and psychological well-being. And you can also try out my Mineral Power program if you like. So you can check that out at live to110.com. You can find me on Facebook and Twitter at I will live to 110. And you can also find me on all the social media. I'm all over the place. And if you like what you heard on the show today, please give me a review in iTunes. It would be so helpful for others to find me and listen to my message. And that's it for today. Thank you for listening to the Live to 110 podcast.